You might have noticed lately that a lot of news is talking about a virus called Mpox, which used to be known as monkeypox. Suddenly, everyone seems to be talking about it, and some people are getting really worried. But why is that? What's making Mpox so concerning now? In the past, Mpox wasn't something most people outside of Africa thought about. It was a rare virus primarily found in certain parts of the continent. But recently, more cases have been popping up in different countries, and that's got a lot of people asking, is this the next big global health threat, or is it just another thing the media is hyping up?
Who knows?
In today's video, we are going to discover why Mpox is gaining so much attention and what you need to know about it. Mpox, known initially as monkeypox, has an interesting history that dates back several decades.
Interesting.
The virus was first discovered in 1958 when there were two outbreaks of a pox-like disease in colonies of monkeys kept for research. This is how it got the name monkeypox, even though monkeys aren't the primary carriers. The virus is mainly spread by rodents, like rats and squirrels in parts of Africa.
She called me rodent!
The first recorded human case of Mpox occurred in 1970 in the Democratic Republic of the Congo. Since then, there have been sporadic outbreaks, mainly in Central and West Africa, where it was considered a rare disease. For many years, Mpox remained largely unnoticed by the rest of the world. However, things changed recently when Mpox began appearing in countries outside of Africa. This unexpected spread caught global attention, leading the World Health Organization to declare Mpox a global health emergency. This declaration highlighted the need for international cooperation and awareness as the virus began showing up in places it had never been seen before.
I've never seen that before.
Now, with Mpox in the spotlight, it's essential to understand where it came from, how it spreads, and why it's becoming a concern worldwide.
It's a societal concern.
Mpox is caused by the monkeypox virus, a member of the orthopox virus family, which also includes the smallpox virus. This virus spreads primarily through close contact with an infected person or animal. It can be transmitted via bodily fluids, respiratory droplets from coughing or sneezing, and even direct contact with an infected person's rash or sores. Mpox can also spread through contaminated materials like bedding or clothing.
It's that easy.
The symptoms of Mpox usually start with flu-like signs such as fever, chills, and muscle aches. As the infection progresses, a distinctive rash develops, often beginning on the face and spreading to other body parts, including the hands, feet, and even inside the mouth. The rash eventually turns into fluid-filled blisters that crust over and fall off. Another common symptom is swollen lymph nodes, which can help differentiate Mpox from other similar infections like chickenpox or smallpox. While Mpox is contagious, it's less easily spread than diseases like COVID-19.
Thank God!
Transmission requires much closer contact, making it less likely to spread through casual interactions. However, the rise in global cases has raised concerns due to its spread in communities and the potential for complications, especially in people with weakened immune systems or underlying health conditions. So now let's discuss why Mpox is gaining that much attention worldwide. Mpox, once a disease primarily found in Central and West Africa, has recently made headlines because it's now appearing in countries where it hasn't traditionally been seen. For decades, Mpox was confined to rural areas in Africa, with cases rarely leaving the continent. However, the virus has spread to Europe, North America, and Asia in recent years, raising alarms globally. One reason for the heightened concern is the emergence of a new strain of the virus that seems to be more virulent, meaning it could potentially cause more severe illness or spread more easily.
What?
This new strain has been detected in different parts of the world, and scientists are keeping a close eye on it to understand its behavior and how it might impact different populations. Vulnerable groups like those with weakened immune systems are particularly at risk, making it crucial to monitor and manage the spread. The spread of Mpox has been fueled by increased international travel and urbanization. With more people traveling between continents, the virus has had more opportunities to cross borders. Additionally, as cities grow larger and more crowded, close contact between individuals becomes more common, facilitating the spread of infectious diseases like Mpox. These factors and the virus's ability to spread through close contact have contributed to its alarming spread beyond its traditional boundaries. When comparing Mpox to COVID-19, it's essential to understand the differences in how these viruses spread and how severe they are. COVID-19 spreads primarily through respiratory droplets and has a much higher transmission rate. meaning it can spread quickly from person to person, even in casual settings. EMMPox, on the other hand, requires closer, more prolonged contact, such as direct skin-to-skin contact or contact with bodily fluids, making it less contagious overall. Health experts believe that MPox is unlikely to escalate into a pandemic on the scale of COVID-19. The primary reason is its transmission mode. Since Mpox doesn't spread as quickly as COVID-19, it's less likely to cause widespread outbreaks. Additionally, the symptoms of Mpox, such as the visible rash, tend to appear early in the infection, making it easier to identify and isolate cases, thereby preventing further spread.
It could have been worse, John. A lot worse.
Despite these differences, efforts are being made to prevent Mpox from becoming a more significant threat. Public health authorities are focusing on vaccination campaigns, especially in areas where the virus is spreading. Vaccines originally developed for smallpox are effective against Mpox, providing a valuable tool in controlling the spread. Other preventive measures include public education on avoiding close contact with infected individuals and encouraging good hygiene practices. Global health organizations, especially the World Health Organization, have been actively monitoring and managing the Mpox outbreak.
It was preventable.
WHO has provided guidelines for countries on responding to Mpox, including surveillance, case reporting, and public awareness campaigns to help control the spread. These efforts are crucial in regions where the virus is emerging and in areas where it has historically been present. Vaccination has been a key tool in managing Mpox, particularly in areas where the virus is spreading rapidly. Vaccines developed initially for smallpox, such as the modified Vaccinia Ankara (MVA) vaccine, have proven effective against Mpox. In some regions, targeted vaccination campaigns focus on high-risk populations, healthcare workers, and those in close contact with confirmed cases. These efforts aim to create a buffer against further transmission and protect those most vulnerable to the virus. Early detection is critical in controlling Mpox. Public health authorities are encouraging healthcare providers to recognize the symptoms early, such as the characteristic rash, fever, and swollen lymph nodes. Once a case is identified, swift isolation of the patient is essential to prevent the virus from spreading to others. Treatment focuses on managing symptoms and preventing complications, with antiviral medications available for severe cases. Public health messaging also emphasizes the importance of hygiene and safe practices to reduce the risk of transmission.
There's nothing crazy about good hygiene.
While Mpox poses a significant public health challenge, the global response anchored in vaccination, early detection, and isolation is helping to manage and contain the virus effectively. And now, for the hot debate, is it just a media hype or a real threat? The media is crucial in shaping public awareness about health crises, and Mpox is no exception. However, portraying Mpox in the press often distinguishes between raising necessary awareness and creating undue panic. On one hand, media outlets are responsible for informing the public about outbreaks and necessary precautions.
Social media.
On the other hand, exaggerated headlines and alarming reports can lead to an inflated sense of danger, causing unnecessary fear. When news about Mpox first emerged, sensationalized coverage in some outlets heightened concerns beyond the actual threat level, sometimes overshadowing essential facts. This type of coverage can lead to confusion and even stigma, as people may react emotionally rather than rationally to the presented information. Media must balance urgency and accuracy to ensure the public remains informed without inciting hysteria. Misinformation is another critical issue in the media landscape, especially during health crises. In the case of Mpox, misleading details about transmission, symptoms, or risks have circulated, further complicating the public's understanding of the disease.
Report.
Fact-checking organizations and responsible journalism are essential to dispel these myths and provide the public with accurate, scientifically backed information. Media should serve as a conduit for facts, ensuring the public knows when to be cautious without becoming overwhelmed by fear.
Social media, it's a lie. All right.
In the next section, we will be discussing what should be done in the case of Mpox outbreak. Prevention is vital to protecting yourself from Mpox, especially if traveling or living in high-risk areas. By taking proactive steps, you can reduce your risk of exposure and stay safe. Here are some essential tips. 1. Stay informed through credible sources. It's crucial to stay updated with the latest information about Mpox through reliable sources like the World Health Organization, WHO, the Centers for Disease Control and Prevention, CDC, or local health authorities. These organizations provide accurate, evidence-based information, helping you make informed decisions about your health and safety.
He is reliable.
Number 2, Practicing good hygiene. Regular hand washing with soap and water or using hand sanitizer with at least 60% alcohol is a simple yet effective way to minimize the risk of infection. Good hygiene is critical in avoiding spreading viruses, including Mpox, particularly when handling animals in public spaces.
It's called hygiene.
3. Avoid contact with infected individuals or animals. Mpox spreads through contact with infected people or animals, especially rodents and primates. Avoid touching animals that appear sick or handling materials like bedding that might have been contaminated. If you're in a high-risk area, steer clear of wild animals, and always practice caution when interacting with pets.
Just avoid everything.
Number 4. Be aware of symptoms. Early detection of symptoms, such as fever, muscle aches, and distinctive rashes, is vital. If you suspect you have been exposed to Mpox or begin experiencing symptoms, it's essential to seek medical advice immediately.
George, I have all the symptoms.
Self-isolation and contacting a healthcare provider promptly can help prevent the spread of the disease to others. Taking these precautions can help protect yourself and those around you from Mpox. Staying informed, practicing hygiene, and being mindful of your interactions with others can go a long way in preventing the spread of this virus. In summary, even though Mpox is a global health concern, we can help stop its spread by staying informed, practicing good hygiene, and being cautious in high-risk areas. Follow trusted sources like the World Health Organization (WHO) for accurate updates, and if you notice any symptoms, seek medical help right away. If this video was helpful, please like, share, and subscribe for more important health updates. Stay safe and stay tuned. Thanks for watching.